Welcome. Welcome, my dear friends. Myself, Professor Dr. Deshpande, would like to welcome you all in my Ayurveda Academy YouTube channel. As you know that I am MD in Ayurvedic medicine and MD in Ayurvedic physiology. For paid online consultation, you can definitely WhatsApp on 922681060. My dear friends, today's topic is a little bit, what I can say, problematic for the many parents, because when they see that their child or the children, they are having such type of the problem, they get tremendous, what you can say, the in a stress. So let us discuss about this particular problem, which can make the stress to the society, to the parents, and the name of the problem is autism. So we are going to discuss something Ayurvedic management, or what you can say, the lookout for this autism management. So autism and Ayurveda, what we can see. Here you can see the different signs of autism. I'm going to tell you afterwards also. Hyperactivity children, then sometimes they are not taking care of what the parents are talking with them or doing with them. That is inattention. Then sometimes if the mother goes near to the child, they, oh, no, no, something, they start crying. So reject the physical contacts. Then there is a type of sensitive to the sounds, some type of convergence or hysterical type of behavior, and opposite, sometimes they can see as a in a depressive mood. So, hello, my dear friends. Today we are diving into fascinating perspective on managing autism spectrum disorder with the ancient wisdom of Ayurveda. Could this traditional medicine offer a new avenue of hope and support? This is my topic. So let us start to explore that topic. Autism spectrum disorder, or ASD, is a neurodevelopmental condition related with the brain, affecting social communication and often accompanied by restricted interest and repetitive type of the behavior with the children or by the child. While modern medicine offers therapies like behavioral therapy, occupational therapy, and speech therapy, many families always seek additional or alternative approaches to support their loved ones. I am today talking about some interesting research paper. In this research paper, we are looking at today, published in Kerala Journal of Ayurveda, dwells into a case study exploring the potential of Ayurvedic management in addressing autism. This particular research highlights that currently modern medicine lacks effective medications to reduce the core symptoms of autism, and while therapies can bring some improvement, they might not always be sufficient for optimal outcome. Now let us talk about Ayurveda's perspective. For autism, Ayurveda thinks in terms of Unmadam and about Agni, or the digestive fire. So, how does Ayurveda's view regarding autism? Interestingly, this ancient system of medicine, Ayurveda, approaches through the lens of Unmad. This is a term that encompasses various neuropsychiatric conditions. The Sanskrit word in our Ayurvedic text is Unmad. This research suggests that Ayurvedic management, alongside of the conventional therapies, can be effective by applying the treatment principles of Unmad and focusing on the correction of Agni, or metabolic process. In Ayurveda, Agni represents the body's metabolic fire and digestive capacity. Imbalance in the Agni are believed to contribute to various health issues, including neurological conditions. By addressing and correcting the Agni, Ayurveda aims to restore the balance within the body and mind. So, the core of this research is a case report detailing the Ayurvedic management of a specific individual with autism. While the paper doesn't provide extensive details within these snippets, it does mention some key Ayurvedic treatments that were implemented after an initial Shodhana process. Shodhana is a detox process, purificatory process. So, by the age of 2.5 years, the parents noticed that their child had a lack of attention, jumping and laughing without any reason, had less eye contact, was afraid of the sound of a pressure cooker, mixer grinder, or any other loud noises. Strangers' anxiety, fear of water, this and that, fear of bathing, brushing teeth, etc. Repeated handshaking movements. So naturally, they took the consultation of the family physician. Then, what the Ayurvedic Vaidyas they think and start the management. First, they start with the Rukshana or Deepana. Rukshana and Deepana. So, Utsadana, massage with the dry powder with Kolat, Kola Kulathadi Churna. What is the name? Kola Kulathadi Churna means powder and Dhanyamla. Then in addition to that, Gandharva Hastyadi Kashayo, the name of the medicine. Gandharva Hastyadi Kashaya. Okay? Gandharva Hastyadi Kashaya, 4 teaspoons with equal amount of water before food, morning and evening. Then Ashtachurna. Ashtachurna, 5 grams, twice daily before food. These all the treatment for 7 days to improve the appetite, to improve the metabolic process, to improve the digestive file. Then Sneha Pana, lubrication with the medicated ghee. The name of the ghee, Kalyanaka Ghritam. Kalyanaka Ghritam started with 10 ml and attended, gradually increase, Samyak Snigdhata. That is the optimal symptoms for getting the proper lubrication. Samyak Snigdhata. On the 8th day, with 50 ml. So gradually 10 ml, 20 ml, 30 ml. On the 8th day, it was a 50 ml. Then again, Abhyanga and Ushnodaka Snan was given. Then there was Vata Sani Thailam. Vata Sani Thailam. Thailam is oil for 3 days. By this Vata Sani Thailam, attention of that child was improved. Then Mrudu Virechan was given. What is that? Mrudu Virechan. Sukumar Erandam liquid. Sukumar Erandam 10 ml 1 day. And by that treatment, gradually, again, hyperactivity was also reduced by that time. Then Basti was given. Basti, medicated enema. Dvipanchamuladi. Dvipanchamuladi Yoga Basti was given for 8 days. Dvipanchamuladi Yoga Basti was given for 8 days. Then what happens? Marked reduction in stereotype actions. Marked reduction in the stereotype action was taken place. Then Shiro Pichu, oil swab on the head. Shiro Pichu, that again Vatasani Taila, 14 days that was given, started after the Shodhana. After the Shodhana, what happened? Eye contact improved. Eye contact was improved. Then there was a treatment called as the Takradhara, shower on the head. Takra, buttermilk. Then Musta Amalakya Takra. That buttermilk was processed with musta and amalaki. So musta amalakya takra 14 days started after shodhana. By that time, the child starts speak a few new words. New words is very important. Then Pratimarsha Nasya was given. Pratimarsha Nasya, nasal drops, nasal medication. That was Kshir Bala Thailam. Thailam is oil. 21 avarti processed many times. 21 avarti Kshir Bala Thailam. 2 drops here, 2 drops here to the child. For 7 days, Nasya was given for 7 days. Okay? Then Shamana Chikitsa was started. Shamana, palliative treatment. What was given the medicines? Drakshadi Kashayam. Drakshadi Kashayam. Kashayam means decoction. That was 45 ml thrice daily before food. Then Manas Mitra Vatakam. Manas Mitra Vatakam. This is a tablet. Vatak is a tablet. One tablet by some mortar and pestle by making grinder and very smooth paste was prepared. With the honey, it was given, or with the Kalyanaka Ghritam, it was given. 10 gram twice daily. This was all the Shamana Chikitsa was started after the purification or detox. Shodhana in Ayurveda refers to the purification and detoxification therapies aimed at eliminating accumulated toxins from the body. Very simple. Following this, the case study mentions the use of specific Ayurvedic formulations, like Brahmi Ghritam was used for this child of autism, dose of 5 grams twice daily, and Kalyanaka Ghritam was used 10 grams twice daily. These medicated ghee preparations are traditionally used in Ayurveda to support the cognitive function and mental well-being. Okay? Now, it is important to remember that this is a single case report, and further research with larger sample size is needed to establish broader conclusions. This is very normal. But single case study can give us a stimulation to understand the Ayurvedic perspective. However, this research offers a valuable glimpse into how the Ayurveda can be applied in the context of autism management. This research paper briefly touches upon the potential role of microbiota in autism. Microbiota. While the snippets don't elaborate extensively, this is a growing area of interest in both modern science and Ayurveda. Ayurveda emphasizes the importance of a healthy gut for overall well-being, including your mental health. It is conceivable that Ayurvedic interventions could positively influence the gut microbiome, which in turn might impact autism symptoms. This particular connection between the gut and the brain, often referred to as gut-brain axis, is a fascinating area of research where traditional Ayurvedic wisdom and modern scientific understanding may converge. They both are agreeing. Yes, there is a connection of your intestine and the brain, your digestion, metabolism, and the brain. Importance of holistic management therapies. This particular researcher emphasizes that Ayurvedic management should ideally be integrated with existing therapies like behavioral therapy, occupational therapy, and speech therapy. Ayurveda is not presented as a replacement for these crucial interventions, but rather Ayurveda is a complementary type of approach. This holistic perspective addressing the individual on multiple levels, physical level, mental level, emotional level, is a cornerstone of Ayurvedic philosophy. By supporting the body's natural healing mechanism and promoting overall well-being, Ayurveda may contribute to the improved outcomes for the individuals with autism. It is very crucial to highlight the ethical consideration mentioned in this particular research paper. The authors clearly state that they obtained informed consent from the caregiver for reporting the case, ensuring the privacy and anonymity of the individual involved. This underscores the importance of ethical practices in any research or case reporting, especially when dealing with vulnerable population. This case report offers a promising, albeit preliminary look at the potential of Ayurvedic management in supporting individuals with autism. While more extensive research is warranted, it highlights the value of exploring traditional system of medicine as a complementary approach to the modern medicine. My dear friends, if you found this particular video informative, please like it, share it. And also, I would like to know what are your thoughts regarding this topic. Have you or someone you know explored alternative approaches for managing autism? If you know anything, anybody, please let me know. Let us know in the comments below. Thank you for watching. Don't forget to subscribe for more insightful content on the health, wellness, and traditional medicine. We will see you in the next video. Thank you very much and take care, my dear friends.